Okay, good morning, sir. I am Grace Joy Bigalbal, your student nurse from Wesleyan University of the Philippines. And the goal of my demonstration for today is performing the abdominal assessment. This will help you detect health problems in the patients earlier and to prevent further complications from developing with existing disease. Sir, good morning. I am Grace Joy Bigalbal, your student nurse from Wesleyan University of the Philippines, and I will take care of you from 7 a.m. to 1 p.m. For safety purposes, may I hold your hand as I check your ID band? So, sir, can you confirm your name, age, and birth?
TJ Bote, 18 September 8, 2004.
Okay. So, now that we already know the patient's identity, it is also important to explain the procedure to the client so that they will know how they can participate during the assessment. So, the procedure that I will be doing, sir, is that I will be checking some part of your abdominal area. But before that, I'm going to ask you for your consent. So, is it okay with you to touch some part of your abdominal area? And also, I'm going to remind you that everything that will happen here for the assessment will be fully determined and will remain confidential between you and me in that every position that I'm referring to. Okay, sir, before we start with our assessment, please allow me to secure your privacy by closing all the curtains. Okay, now that the privacy is secured, I'm going to perform my basic hand hygiene and put my gloves on. Okay, sir, may I assist you to change your clothes, and I'm going to assist you to do the supine position, placing both of your arms on the sides comfortably. Sir, you can now lie down. Sir. For the inspection of the abdomen, inspect for skin color, vascularity, and contour. Note for any presence of striae or stretch marks, scars, lesions, wounds, or the skin damage. Okay, so the patient's abdomen seems to be normal. Skin is unblemished and free of lesions. Also, the abdomen of the patient is flat in contour. Document for any unusual observation. Okay, now we're going to proceed on inspecting the umbilicus of the patient. So, inspect for color, location, and contour. Okay, so the umbilicus of the patient has a normal color located on the normal position, and the contour presents no abnormalities, and also the patient's umbilicus is concave and positioned midway between the hypogastric and the xiphoid process. Document for any inconsistencies. Okay, now for the abdominal measurement circumference. Sir, can you please stand as I measure your abdomen? Okay, now I'm going to measure the patient's abdomen using the medida. Okay, so the patient has a 30 centimeters abdominal measurement circumference. For the auscultation, I will be using my stethoscope on diaphragm side to listen for the bowel sounds of the patient. Okay, so for the normal findings, normal active bowel sounds heard to all the four quadrants, the high pitch and the gurgling sounds. Okay, now for the palpation, there are two techniques of palpation, the light palpation and the deep palpation. So sir, I will lightly palpate all your 9 regions of your abdomen, observing for any guarding behaviors which indicates pain or discomfort. As well as observing for the facial changes of the line. Okay. So after the light palpation follows the deep palpation. Observing again for any signs of pain or discomfort. Okay, so upon palpation, the normal findings will be documented. And lastly, for the percussion, we will be only focusing on percussing the right side of the abdomen of the patient, and especially the borderlines of the liver for any unusual sound. Okay, so the predominant sounds are tympany and dullness. So the tympany is elicited in air-filled structures, and the dullness elicited in the solid or organs. Okay, now the abdominal assessment is complete. So sir, you can now tidy up your clothes again, and thank you for your cooperation. All the significant details will be documented and reported to the physician. That's all for this assessment, sir. Thank you so much.